To mask or not to mask? Well, that is the question when it comes to COVID-19. Health units across Ontario have been grappling with the issue of whether or not masks should be mandatory in indoor public places. Toronto, Ottawa, Brampton, Mississauga, and Windsor-Essex have all implemented mandatory mask policies. Thunder Bay so far has not, and that is generating some discussion. Dr. Janet DeMille is the Medical Officer of Health for Thunder Bay, and she joins me on the line. Dr. DeMille, good morning.
Good morning.
Thanks for joining us. So I wanted to start by talking about a Facebook post on your feed, and I think you'll know which one it is because it's been generating a lot of discussion. So the post said, it's okay to wear a mask, it's okay not to wear a mask, be kind to each other. Why did the health unit post that?
You know, I think the big reason for that is something that we've seen, whether in a number of areas related to this pandemic in our communities, that there's often a sort of a stigma or negativity associated with individuals who at some point it was individuals who had COVID or other issues, but we see it a little bit with people, judging or people who either are wearing masks or who are not wearing masks. And I think one of our key messages throughout this has always been, compassion for others and to be kind and be respectful. So that did prompt that Facebook post at that time. I do recognize, actually, though, that at the same time there was a lot of, in many ways, changing conversations across the province about masking and the value of masking. And perhaps there was a bit of a contradiction in terms of that broader conversation that's happening provincially and that we were starting to have here and how that Facebook post initially came across.
So what do you say to people who do feel vulnerable and who think the health unit should be doing more to promote use of masks as a precaution?
Well, you know what? I think it remains, a rather, challenging issue around masking and the potential benefits of masking and the downside of masking as well. It is not a panacea. I do, in terms of COVID and reducing COVID spread in our community. I do see things, whether it's on social media or even in the news, that sort of seem to not kind of portraying it as perhaps a lot more beneficial than it actually is. It's not to say that broader masking wouldn't be beneficial for us, though. We are looking at that, and we are actually in the process of updating our messaging to strengthen mask use in the population. And moving forward with that, ideally, it would be nice to see, wearing of masks in indoor spaces, especially when you can't necessarily properly physically distance within those spaces. It would be nice to see more masks being used and more masks being used properly, if I could say that. And I look at this as being beneficial. Maybe not so much now because we have very little COVID in Thunder Bay and in other communities in this area. We've been in, phase 2 of the reopening for almost 3 weeks now. But I could see it being beneficial, especially even in the fall, for example, when we do anticipate a second wave where we will see more COVID in the community and more community spread, that there is benefit for more of us to be wearing masks, especially when we're in closer proximity to other people, which we will be as the weather gets colder. It is important to realize, though, that masking and wider spread use of masks is only adds another layer of protection for us. Again, it's not a panacea, and it still must be used with all of those other measures, including still maintaining physically distance from one another, that 2-meter range, for example, hand washing and frequent hand washing and use of hand sanitizer when people can't necessarily wash their hands, and of course staying home when you're sick. All of these will still need to be in play, and masking can provide another layer of protection on top of that.
You mentioned there that you want to get out the message about wearing masks, but also proper use or proper wearing of masks. What did you mean by that?
Yeah, so I mean, my current recommendation right now, we're going to be, looking at this and putting out more messaging and strengthening our approach, is basically I'm encouraging everybody to make sure that they have masks that they're prepared to use, that they have available to them. So if they're going into a store or an establishment, especially one where they can't necessarily guarantee they're going to be physically distancing, that they have it available so that they can use. And a part of that is actually also reviewing what is proper use of mask. How do you put it on properly? How do you take it off? How do you make sure that it fits properly? Certainly, I live in Thunder Bay. I go to and I see people wearing masks. I wear a mask myself, and I see a lot of noses. I see people, wearing the mask below their nose or touching the mask or adjusting it, and I think that a lot of that has to do with it not fitting properly. And sometimes, that even happened to myself with one of the masks that I had to tighten up the little straps that go behind the ears because it was a bit too loose. There was a gap. My glasses fogged up, and it had a tendency to fall off my nose a little bit. And it is, if the mask is not covering, like the mouth, it's typically the nose, mouth, and chin where it needs to be covering, that it really is not serving much of a purpose at all if it's not covering the nose. So making sure somebody's using it properly, putting it on, taking it off, making sure, and laundering it as well for people who have masks or face covering that they're going to be reusing. How to care for that mask is an important part of, being effective as a community with broader spread use of masks.
Dr. DeMille, we had a couple of new cases reported in the district last week, if I'm correct. Can you just bring us up to speed on where the case numbers stand right now in our district?
Yeah, so I think at this time we have 3 active cases. At least that's what was there yesterday. So in the entire sort of Thunder Bay District Health Unit, there are currently 3 active cases. We're at 92 cases on a cumulative basis in the first wave of since the pandemic began, and we continue to see these sort of sporadic cases like the 2 that we saw last week, and of course we continue to follow up. Certainly the numbers, and there are no outbreaks currently happening right now. So, I think overall we continue to do very well. Our rate actually with 92 since the beginning of the pandemic is about one quarter of the rate in the entire province. So, as we've always done well in this area, and we continue to do well. Of course, we're looking at more broader reopening with stage 3. I don't know when that will happen, and I don't know what that entails at the present time. We're, of course, looking for a broader, potential broader, more cases, broader community spread in the fall with the second wave, for example, of the pandemic. So we're certainly looking forward to that. And, it really is what is the new normal, like the conversation about masks and what we will be doing and other measures that we will be doing and putting in place. All of this is about the new normal. It's about being able to live with COVID in the community with all of the measures in place so that we can still, continue to have businesses open, that we can successfully manage the schools being open, for example, and doing that in a different way. And as I said, whether it's masks, and the ongoing physical distancing, hand washing, staying home when you're sick, of course, the availability of testing so that we can very carefully monitor what's happening in the community, both here in Thunder Bay and in the district communities as well. All of these are an important part of, that new normal.
Dr. DeMille, thank you for your time this morning. Appreciate it.
Yeah, thank you very much.
Dr. Janet DeMille is the Medical Officer of Health for Thunder Bay.